Hi, my name is Rachel Flesher, and today I'm presenting on a paper entitled Family Functioning and Post-Traumatic Stress Disorder in Adolescent Survivors of Childhood Cancer. The purpose of this paper was to look at family functioning and see if it had any effect on the onset of PTSD. The participants for the paper were taken from a randomized clinical trial, which was looking at an intervention for reducing PTSD symptoms and improving family functioning. These families weren't pre-screened for PTSD symptoms or their family functioning, but they were required to have a few characteristics. They needed an adolescent between the ages of 11 and 18 that had their last cancer treatment 1 to 12 years prior to the study and had since then been cancer-free. The average age ended up being 15 years old, and the average time since their last cancer treatment was 8 years. These families were given an FAD, which is the Family Assessment Device. It looks at the organizational, structural, and translational characteristics of the family. It has 7 subclasses, 6 of which look at specific functions of the family, which would be like communication, problem solving, and behavior control. And the 7th was just an overarching generalization of family functioning. This questionnaire had 60 questions, and it was asking the families to rate on a scale of 1 to 4, 1 being strongly disagree, 4 being strongly agree, how it related to their family. And these subscales were capped out at 2. So if you went over 2, then you were considered to be in clinical range, which was problematic. And if you were over 2 on 4 or more of those subscales in the FAD, then your family was considered to be of poor function. Adolescents were given an interview to see if they did have PTSD. This was an audio-taped interview, and they were given kind of like a report to fill out, and it was called an SCID, which is a structured clinical interview for DMS disorders. And it just looks at their mood, their behavior, and they were asked to put it in context to when they were going through cancer treatment and since their cancer treatment has ended. And from there, the researchers were able to see if PTSD was present in the adolescent. Families were also given multivariate analyses of variance, and this would tell the researchers if PTSD and family functioning did have a correlation. So there were 2 different multivariate analyses. One was given to single-parent families and the other was given to 2-parent families. And from there, they were able to kind of create a correlation. Some results of this study showed that 47% of adolescents believed that their family was of poor functioning, and that only 25% of mothers and 33% of fathers felt the same way. And across the board, adolescents always felt that there was a higher amount of poor functioning in their family than their parents did. A third of the participants had 4 or more subscales over that 2.0 cap, so a third of the families were considered to be of poor function. 8% of the adolescents screened did have PTSD, and they showed that patients that did have PTSD were 5 times more likely to come from a family of poor functioning, which kind of came from that multivariate analysis that was done. And the overarching conclusion of the study said that yes, there is a correlation between poor family function and onset of cancer-related PTSD. And from there, the researchers wanted to take this information and put it towards an intervention of some sort to help families learn how to properly relate to one another, to communicate, to problem solve. They said that they would need to do a little bit more research because there wasn't any prior that really focused in on this specific subset of people, and that they couldn't say for sure if there was an absolute correlation since they had nothing to really compare it to. So I would say that one of the downfalls of the study was that there wasn't a lot of background information, and that they were going for a specific subset of people, only English-speaking families, and of a certain age range, that kind of limits the information that they can find. So thank you so much for watching.